Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here in this video we can see questions from fundamentals of nursing. In the previous video we discussed questions from community health nursing. Surely these questions will helpful for your studies. This all questions from previous year question papers, and also I included important questions. We can see the question one by one. First question: who is the author of the book Notes on Nursing? What it is and what it is not? And our options: option A, Florence Nightingale; option B, Virginia Henderson; option C, Dr. Ashok Gowli; option D, none of this. And the correct answer is option A, Florence Nightingale. Book name is Notes on Nursing, What It Is and What It Is Not, by Florence Nightingale. Option A. Move on to the next question. International Council of Nurses (ICN) was formed in the year. Option A 1879, option B 1889, option C 1899 and option D 1891. ICN, International Council of Nurses, was formed in the year 1899. Option C is the correct answer. And the next question: the headquarters of International Council of Nurses is located at option A, London, option B, Geneva, option C, Chicago, option D, Canada. Headquarters of ICN is located at Geneva. Option B is the correct answer. The International Council of Nurses was formed in the year 1899 and its headquarters in Geneva, Switzerland. Its main objectives is to promote the development of National Nurses Association. Move on to the next question. The temperature of a child under 4 years of age should be taken by options: option A, by mouth, option B, rectum, option C, axilla, option D, all of this. Temperature of a child under 4 years, that is below 4 years, should be taken by axilla. Option C is the correct answer. Usually we should not take temperature by mouth in case of children under 6 years of age. Okay, because there is a chance of biting of the thermometer. So we should not take temperature by mouth if the children's under 6 years of age. So mostly we are preferring to take temperature by axilla. Okay, so option C is the correct answer. And the next question: which route one is used to identify hypothermia in a newborn? Options: option A, oral, option B, axillary, option C, rectal, and option D, surface probe. And the correct answer is option C, rectal. The route which is used to identify hypothermia. Hypothermia means temperature will be below normal. Okay, so hypothermia in newborn can be identified. Mostly can take temperature by using a rectal method. Option C is the correct answer. And some important point: most commonly used method for taking temperature is axillary method, and most accurate and reliable method of taking temperature is by rectal method, because rectal area contain large amount of blood supply and it is not influenced by external air, so we can get accurate result. Okay. And the next question: maximum oxygen delivered to the patient by which method? And options: option A, by oxytent, option B, by nasal cannula, option B, by mask, option D, by non-rebreather mask. And the correct answer is it is through by non-rebreather mask. Option D is the correct answer. Non-rebreather mask provide high concentration of oxygen, that is about 60 to 100% of FiO2. FiO2 means fraction of inspired oxygen. So the maximum amount of oxygen delivered by non-rebreather mask, it provide about 60 to 100% of oxygen. And partial rebreather mask provide about 70 to 90% of fraction of inspired oxygen. And Venturi mask delivers 40 to 60% of fraction of inspired oxygen. So Venturi mask is the most reliable and accurate method of oxygen delivery to the patient. Here our question is maximum oxygen delivered to the patient by which method? So it is non-rebreather mask. It delivers about 60 to 100% of oxygen. And the next question, use of cautery is prohibited with options. Option A, nitric oxide. Option B, ether. Option C, halothane. Option D, carbon dioxide. Here, cautery means cautery is a device which is used to control bleeding during the time of surgical procedure, and also it is used to cut small tissues during surgical procedure. Okay, so this cautery is prohibited along with use of ether. Option B is the correct answer because the ether, if we are using along with cautery, may cause fire. So we are not using ether along with cautery. Option B is the correct answer. And the next question, 1 liter contain how many deciliter? Options, option A 1, option B 10, option C 100, option D 1000. 1 liter contain how many deciliter? That is the question. So it contains 10 deciliter. 1 liter contain 10 deciliter. 1 deciliter is equal to 100 ml. So in our question, 1 liter contain how many deciliter? It is 10. Okay. And the next question, 1 teaspoon is equal to how many drops? 1 TSP means teaspoon. And options 15, option B 30, option C 60, option D 120. 1 teaspoon is equal to 5 ml. Okay, it is equal to 60 drops. So answer will come option C 60. 1 teaspoon equal to 60 drops. 1 tablespoon is equal to 15 ml or 15 cc. It is about half ounce. Here our question, 1 teaspoon. And the next question, which of the following medication ordered is immediately and once only administered? Options, option A PRN order, option B stat order, option C standing order, option D single order. Question is medication order is immediate and once only. Immediate and once only means it is stat order. Okay, option B is the correct answer. It is stat order, immediate and once only order. And if needed in emergency means it is SOS. And when required means PRN, that means as needed or when required. Move on to the next question. Intrathecal injection administered through options, option A superficial vein, option B joint, option C cardiac area, option D spine. Intrathecal means it is injections given into the spine. Option D is the correct answer. Intrathecal injections or intraspinal injections means injection given into the spine. Move on to the next question. Appropriate size of ET tube used in adults. Options, option A 2.5 to 4 mm, option B 5 to 7 mm, option C 8 to 9.5 mm and option D 4 to 4.5 mm. Correct size of endotracheal tube used in adult. And the correct answer is, it is 8 to 9.5 mm for adult. Endotracheal tube which is used in different age group, we can see for newborn the weight is about 2 to 3 kg and the size is 2.5 to 4 mm. For infant 0 to 1 year of age, its size is 4 to 4.5 mm. And children up to 10 years of age, its size is 5 to 7 mm. And children above 10 years of age, its size is 7 to 8 mm. For adult size is 8 to 9.5 mm. In our question, the endotracheal tube which is used for adult is 8 to 9.5 mm. Move on to the next question. Which gauge diameter needle is used for intradermal injection? And our options, option A 21 gauge, option B 23 gauge, option C 24 gauge and option D 26 gauge. For intradermal injection, we are using 26 gauge. Option D is the correct answer. For intradermal injection, the syringe size we are using 1 ml syringe or 0.01 ml unit syringe. Okay, that is tuberculin syringe we are usually using for giving intradermal injection. And the needle size is 26 gauge or 27 gauge diameter needle is using for giving intradermal injection. And the length, suppose length they will ask, length means 3 by 8 to 5 by 8 inch length. Length is 3 by 8 to 5 by 8 inch length. Move on to the next question. An informed consent is obtained from a pre-operative patient is to prevent option A, complications, option B, any fault, option C, legal implications, option D, all of this. And the correct answer is to prevent legal implications. So before any surgical procedure, we are taking consent from the patient. It is to prevent legal implications or legal problems, to prevent legal issues. And the next question, collapsing pulse is also known as options. Option A, bounding pulse, option B, water hammer pulse, option C, bigeminal pulse, and option D, pulse alternance. Collapsing pulse is also known as water hammer pulse. Option B is the correct answer. Collapsing pulse is also known as water hammer pulse or Querrigan's pulse. Okay, it is a water hammer or collapsing pulse means it's a full volume of pulse but rapidly collapsing. Pulse interval will become collapsing, and it is usually seen in case of aortic regurgitation or aortic incompetence. Here we discussed one set of questions from Fundamentals of Nursing. All questions are from previous year question papers. Surely you will get an idea from where the questions already came, so you can study according to that. Okay, so the next set of questions we can see in the next video.